I'm Rami Kaldas, and I have been practicing in northeast Wisconsin in the fields of fertility and endometriosis, pelvic reconstruction for the last 21 years. And I have a special guest tonight with me, Kate Shattuck, our certified fertility nurse at the Kaldas Center. And we are delighted and excited to talk with you tonight about fertility issues during the holidays, because people get all weird about it at the holidays, and that's hard on our patients, and we want to talk to you about that tonight. So we'll be discussing the causes and treatments and ways of dealing with infertility, especially during this time of year.
That's right. I'm honored to be here today. I've worked with Dr. Kaldas for 9 years and have shared with his patients the joys, also the struggles that have come along with their journeys on infertility, and we're excited to be here tonight with you and have you tune in so we can discuss any concerns or questions you have about fertility and the holidays and how we can help you get through them. As always, please consult your doctor before doing making any medical decisions. And if you'd like any information about the Kaldas Center, please visit our website at kaldascenter.com or give us a call, 920-886-2299.
So our first question comes from Stacy. And Stacy asks, we've been trying to have a baby. How long should we try before we see a doctor about infertility? I'd say there's an academic answer to that, Stacy, and a practical answer to that, but I'll see what Kate thinks about this.
So for women under 35, if you've been trying to get pregnant for 1 year, they say after 1 year you should seek out a doctor. Over 35, if it's been 6 months, but it's also to your discretion and your wishes for your family. So if you have any medical problems with your cycles, or just are fed up and you want to get going right away, you can definitely give a call and get in and
exactly. Mm-hmm. Yeah, because sometimes the frustration is such that you and is so anxiety provoking that you might want to just consult with your doctor or give us a holler a little bit sooner, and we can either say, hey, you are so right, you should be coming in earlier because this or this is going on with you or your partner, or you can wait a little bit longer, and because statistically it may work before you if we just give it a few more months. Mind you, none of our patients are numbers. Each one is an individual. Each couple is unique, and so we need a very personalized approach to the situation to optimize the situation for you. Okay, thank you, Stacy. And the next question comes from Rebecca. What is the most common cause of infertility? Well, the most common cause of infertility is anovulatory dysfunction. However, meaning like things like polycystic ovaries or polycystic ovary syndrome, which is not identical. That's a nuance, but that's another story altogether that we can talk about in person if you want to sometime, Rebecca. The other things are like endometriosis. Endometriosis that affects 10 to 15% of women in this country and may be silent. You may have silent endometriosis, reduces fertility by about 50%. In addition, it can be a tubal factor. You can be born with conditions that have made your uterus different, and it can be fixed, but it's causing the tubes not to work properly. It can be an issue of male factor, which is about 40% of the time is a male factor issue. 20% of the time is a combination of both female and male factor. And so those are the main causes of fertility challenges. But once again, it just takes a good history and physical for someone who is involved in the field and knows what they're looking for to figure it out pretty doggone quickly. And what do you think, Kate? You get a lot of calls every day, for people who have been trying for a long time. Sometimes, sadly, they've gone through 3 or 4 doctors and they've been at it for many years, but they feel like they're in the wilderness still. Right. What do you think about it?
I agree. I always tell patients that we're good detectives here. So we like to get that missing piece to their puzzle with their infertility struggles to complete that picture and help them get pregnant but it's just, you have to just find that right piece that's missing.
That is an excellent description. We're good detectives. I love that. I think that's so true. Okay, thank you, Rebecca. So the next question comes from Laura. I've had endometriosis for 3 years now. Will it make it harder for me to have a baby? Or it depends on, how you look at it, Laura. Endometriosis does reduce fertility, like I mentioned, by about 50%. However, once you get pregnant, it should not make it harder for you to have the baby, and it shouldn't complicate the delivery per se. However, you say you've had endometriosis for 3 years. I assume you mean that you were diagnosed 3 years ago. And endometriosis, you need to really consider that it is a systemic condition. It's an autoimmune systemic condition that has one of the ways it expresses itself is that endometrium, the lining of the uterus, implanting outside the uterus and wreaking havoc in the pelvis and with your fallopian tubes and your ovaries and so on, and causing all kinds of discomfort. So it can present in many ways. And what are some of the some of the presentations that people call with when they have endometriosis case?
Sure. A lot of times their cycles are really painful for them. Intercourse may be painful. They may have spotting before their cycles start or even after. That they could have pain with bowel movements, things like that. And they don't always want to talk about them. Those things are kept secret until one day you explain it to someone and maybe Dr. Kaldas and
right. It's not proper dinner time conversation.
No.
And we've run into couples that frequently the lady in the couple has not mentioned the discomfort that she's having even to her husband even because she's concerned about what he'll think and he might find her less attractive. And so we help couples go through this. And the key with this concerning fertility is recognizing it that there's never an individual who's infertile. It's always a couple who is having challenges. And a lot of information is passed and understanding is to be had. And then appropriate therapy. If it's long-term management, medication is going to be part of that. Perhaps if it's more acute management, removal of the endometriosis is important, which is a refined skill that really, sadly, not many people across the country do. There's a lot of inadequate surgery that makes the situation worse, and so you just need qualified, a proceduralist who knows how to remove the endometriosis safely without injuring anything, and the results are profound. All other things being equal, 80% of people with endometriosis will be pregnant within a year of that procedure, and 90% within 2 years if nothing else is done, if everything else is in order. So the next question comes, I'm sorry. So obviously, as we're talking, please go ahead and take our number down. If you have any questions or comments, later tonight, feel free to call us at 920-886-2299. Obviously, we open up at 8:30 in the morning, so please wait until then. But we'd be happy to talk with you on the phone and direct you in the right direction, whether that be coming in for a visit at the Kaldas Center or talking with your doctor or otherwise. Okay. So an anonymous writer writes in and asks, my husband and I have been married for 3 years, and his mom won't stop asking when we are going to have a baby. We are now looking at infertility treatments. I know she's going to ask about it at Christmas. Is there a simple way to let her know to stop asking? Ooh, I need our expert, Kate, our expert Miss Manners here, how to deal with mother-in-law.
Well, and it depends on your relationship with your mother-in-law. If you feel open enough to explain to her that maybe hasn't been the right time, or maybe you guys have been trying already. It's kind of preparing yourself for that conversation too, whether it be your mother-in-law or anyone else at the holidays.
Mm-hmm.
People aren't always sensitive that you may already have thought that question yourself. But it's whatever you're most comfortable with. If you want to maybe talk to your husband about it and have him say something beforehand. If you guys have already dove into treatment or you're workup and you don't want to talk about it. Maybe have them already preface that. Please don't talk, about this at Christmas this year. This is a happy time, and we don't want to be consumed by something that may be giving us some sadness right now. So.
Right, exactly. That's so well put, Kate. And maybe you can talk with your husband and just maybe have him whisper something in his mom's ear. It's a sensitive topic, and what you need to understand is that sometimes parents live vicariously through their children, but they don't have a lot of understanding for the situation, and frequently they don't even know what they're saying is causing you anguish, and it's unfortunate, but it is. They don't even know what to say, but they shouldn't. In fact, if you want to be honest with them, you should say, "Don't say anything, please." But of course, then they feel guilty, and they think you're doing it on purpose. And some grandparents even think the children are doing it to spite them or something like that. Which every family is different. And so I would just take a gentle approach with the parents and the parents-in-law, as Kate was saying, and maybe advise them, even because fertility, there's a grieving process with it until you achieve success on that front. And maybe you should advise people when they've asked a couple of times, and if they keep asking, say, "Hey, why don't you not ask how it's going? Why don't you just ask how I'm doing today?" And you're going to have your good days and your bad days, and then they should just stop right there. And maybe you should just give them a little bit of feedback like that, rather than letting them continue asking things that are injurious. And the next question we have comes from Julia. I've seen some women have fertility treatments and end up with triplets or more. Is that common with fertility treatments? Well, Julia, okay, we've had a set of triplets recently, and it can happen, even with oral medications. It happened with oral medications recently with one of our patients where Clomid is just 1% risk of triplets. And do you know what? That's 1%. And it happens. And so we do so many cycles, so it is not without risk. And of course, when you have triplets, you have the risk of prematurity associated with that. And fortunately, this set of triplets actually made it to full term, and the babies all went home with them, and it was all beautiful. However, that is a very serious question that you need to think long and hard about. And there are ways that we can minimize the chance of that, however, not entirely eliminate it. Because, for example, you can have 2 follicles only during a cycle, and one of them could split, and you could have identical twins in another baby. It is not entirely 1,000% within our control concerning the triplets, but we can make an educated guess how likely it is and either proceed or not with the cycle. And how do you handle that when, because Kate is, discussing follicle checks. Why don't you go just briefly through follicle checks and how we try to avoid multiples like that, Kate?
Thank you. So a lot of our patients are on, whether it be an oral medication like Clomid, like Dr. Kaldas talked about, or injectable medications. We can do ultrasound monitoring. The patient comes in around the 10th day of their cycle, and we are able to see how their body responded to that medication. The number of follicles that are ready will give us a risk for how many multiples that they could be at. We discuss the risk of multiples with our patients, and it also, our goal is to have maybe a couple of follicles because it helps our chances of getting pregnant. But we also discuss the risk associated with multiple gestation pregnancies. If it gets to a point where we have too many follicles, of course we keep our patient's safety and their future baby's safety in mind, and counsel them accordingly on whether they should proceed with treatment or not. But we're able to have a good estimate for how your response will be with the medications and what their risk will be after they've taken them. So.
Okay, thank you, Julia. And the next question comes from Jane. My husband and I have been trying to have a baby for about 8 months. We are both feeling very defeated, if not depressed. should we consider seeing a doctor for our mental health as well? Why don't you take that one too, and I'll add, because you hear many stories. Kate is usually talking to our new patients before I do, because she takes the incoming calls amongst other fantastic staff we have at the Kaldas Center. But Kate is a point person for these challenging situations. And what kind of feelings are people expressing when they call in for the first time in similar situations to what's described here?
Well, you're definitely not alone, Jane. Everybody, I feel like that I've encountered has had that feeling of sadness. It's a definite roller coaster every cycle. You have your ups and your downs, but if it gets to the point where it's consuming you or your spouse, then it's time to come in and talk with a physician. We're here to support you. This is a really challenging time for our patients, and so we are looking forward to finding an answer, and then of course helping you achieve your goals. But the support along the way is very important, not only from your spouse and other family that you may be open with and friends, but to know that also you're not the only one who feels like that. Men and women who are undergoing fertility treatment feel the same way, and it's a struggle, but there's things we can do to help you get through that.
Absolutely. And what I have learned over the years is that the element of uncertainty is worse than even knowing that there's going to be a bad outcome. So you want to have a provider who eliminates unknown variables and eliminates uncertainty. Frequently what we'll get that leads to a lot of doldrums and depression in our patients is they have even seen others, and there's a very much a shotgun approach. Well, let's try this, let's try that, let's try this, let's try that. And they go through this for a couple of years, and no forward progress is making, they're spinning their wheels, they're getting more and more frustrated and depressed. And so yes, I think that a mental health specialist, a counselor, is a very good idea, because we have seen couples, break apart because of the stresses of trying to become pregnant. Don't let it get that far. Yes, go see a mental health counselor or professional, but also get the answers. If things do not meet your common sense test when you talk to a provider, or if there seems to be no direction for your treatment, then for goodness sakes, I would recommend you give us a call. Okay. So, as always, please consult your doctor before you make any medical decisions. We are here to, as a resource, to answer questions and to help inform you, but it's to inform you so you are qualified to seek, better medical care from your provider. And so if you would like to speak with us here at the Kaldas Center, please visit our website at kaldascenter.com or call us at 920-886-2299. So, and the next question comes from Rachel. And Rachel and her husband are considering IVF. Is there anything we should be concerned about? What questions should we be asking? Ooh, hey, what do you think, Kate?
I think for most of our patients, the biggest concern with IVF is cost.
Mm-hmm.
They don't want to be burdened by that, especially if they're planning a family. So I would definitely look around for recommendations. We work with many IVF clinics as well, and have used our patient feedback to help guide us in giving those recommendations for future patients too. But cost is a big question for patients, as well as the consumption of time. It's a process. It may take several months for the IVF process, and that can be scary for them when they're approaching that, and knowing that they may be on birth control pills for a few months, and then however many weeks of stimulation, and then the transfer. So it's a hard process, but rewarding at the same time for many. But
that is an exceptionally good answer. Those are the things you really want to inquire about and think about. And you should also ask, do I really need it? And frequently what we're seeing is that family doctors or obstetricians are putting their patients on medication like Clomid for 6 months or 12 months or something like that, and it didn't work, and they say, oh, well, I guess you're going to need IVF. Well, most of the time the person hasn't even been diagnosed. And so first ask yourself, do I really need it? And if you get to that point, we'd be happy to talk with you and advise you forthrightly if we think you really need it. And the next question is coming to us from Kristen. I have already had 2 babies and now struggling to conceive a third. I am only 31 years old, and it is Is it common to become suddenly infertile at my age? Fantastic question, Kristen.
Well, Kristen's secondary infertility, which is infertility after you've already had children, is the most frustrating because you've already achieved pregnancy twice. And you have a wish for your family to have 3 children or 4 children, and that's a struggle when it becomes difficult. You may not be infertile, but there may be other things that have changed since you've had your babies. So it'd be a good idea to make an appointment with your physician, have some workup. Maybe your thyroid's off. Maybe you've got...
Maybe your husband has a varicocele, right? Maybe that his sperm count went down, and that can be corrected, right? Yeah. Or did you have C-sections? Did you have an infection after the C-section? Did you have scarring inside the uterus somehow after a D&C from too much bleeding after one of your babies? Or there are many variables that can go into that. And so, but it's a puzzle that can be solved, and I am confident, Kristen, that you're going to have baby number 3, and probably 4 and 5 if you want. It's just a matter of figuring it out. You're only 31. And the next question is from Kelly. And you mentioned PCOS causes infertility. How does that happen? Can infertility be prevented with PCOS? You want to take that one?
So PCOS can cause an excess of male hormones in the body, which affects ovulation. We need to ovulate to get pregnant. So if we're not ovulating, our cycles may be absent. It's hard to time out intercourse, and that makes it a big challenge. It kind of has a trickle effect through your metabolic system. So
yeah, and significantly with polycystic ovaries, you're not ovulatory. You're not ovulating regularly. Sometimes you're having periods. Sometimes you're not having periods at all. But we've seen many people who are having periods that seem to be regular, but they're actually like 30 to 35 days or 45 days. And in fact, their ovulation is a moving target. And so what people need to understand about polycystic ovaries and polycystic ovary syndrome is it's a continuum from the whole metabolic syndrome of polycystic ovary syndrome versus just mild anovulation on the other end of it. And it all boils down to an insulin resistance in the ovaries, and resulting in the high androgen levels, the high testosterone levels, and so on with polycystic ovary syndrome. And so it can't be per se prevented, but the situation, the metabolic condition can be normalized so your ovaries function properly and ovulate predictably, so you can time it right and become pregnant. Mm-hmm. And Amanda writes saying, my close friends and family know I am struggling with getting pregnant, but I'm still nervous about seeing them during the holidays. I'm afraid they'll ask me about it. Is that normal or silly? Oh, what do you say to Amanda, Kate?
I think that's very normal, Amanda. I would assume that you'd be apprehensive for those meetings with family members, but it's great that they know. And I guess I'd kind of recognize too that this might be a hard time for them too, as they wish for you to have a baby and they don't know how to maybe talk to you about that. So that could be challenging on their end as well. But I'd encourage you to, if you are open to talk with them about it, sometimes discussion and answering questions, like you said, the unknown is the hardest part of this. So that discussion, that open discussion is great.
Yeah, especially the holidays, Kate. Because isn't it the case that Thanksgiving, Christmas, what do you have? You have the whole big family coming together, and all the nieces and nephews are running around, all the rugrats are running around, and your parents are saying, well, her sister didn't have a problem getting pregnant, we don't know why she is, and things like that. And they're just things that just shouldn't be said, that people aren't thinking,
Right.
and it's a really challenging time. So your emotions and concerns are 100% validated. It is a tough time for people who are trying to get pregnant at the holidays.
Right. Try to consume yourself this time of year with things that you love the most. You make choices. Kind of surround yourself with things this time of year that you love doing, and maybe avoid things that might be more hard on you.
Right.
If you're going to a church service, maybe you want to go to one that doesn't have all the littles running
Right.
around, at that time. Kind of prepare yourself for situations so that you can kind of guard your heart a little more.
Mm-hmm. Excellent. Mm-hmm. Okay. How often is the man the cause of infertility? What is the most common cause for a man? Maggie asks. Well,
Like you said, 40% of the time, infertility is male-related.
Mm-hmm.
Like you said, a varicocele. There can be varicocele, hormone imbalance.
Mm-hmm. Right, but sometimes there's no, the urologist that we work closely with when we find a male factor going on can't find any reason for it. The hormone levels are normal, and it could be anything in the development of those testicles early in life that has resulted in low sperm count or sperm that are misshapen, so they can't break into the egg. And so, but varicoceles are the most identifiable and treatable cause for male factor fertility. But even if there is absolutely zero sperm count, though it is expensive, you can do in vitro fertilization with intracytoplasmic sperm injection and extract immature sperm from the testicles and actually inject them into the eggs, though it is a little costly, but that is a very rare thing, and most of the time you won't need in vitro fertilization and the cost and hassle associated with that. Okay. And what is your ideal Christmas or holiday dinner? Ooh.
I like a good old ham loaf.
That sounds perfect.
Yes. My mom makes a killer ham loaf.
That's fantastic. Some roast beast of some sort. I guess I'm particular to Cornish hens myself, but that's a great question. Yeah, I'd like to actually learn how to make some of these dishes. That would be great fun.
Well, we can't forget the Christmas cookies either.
No, can't forget that.
No.
Yep. The swimming time is a long ways away, so we can not worry about our weights right now and enjoy. So it looks like we are all out of time. If we did not get to your question tonight, we apologize. Feel free to contact us or check back in for our next question and answer session. Thanks for joining us, and have a happy holiday. And remember, even though Jesus was an immaculate conception, when you come to the Kaldas Center, more likely than not, way more likely than not, you're going to get pregnant. And it's not, even though every baby is a little miracle, it is not rocket science. We'll get you there, or you'll know exactly what you need to do. All right? Have a happy holiday.
Bye.
Bye-bye.